When I retired, I wanted to backpack in the wilderness areas, camping, and spend a lot more time with my daughter and granddaughter. I'm John, and I had a left hip revision, and then I had a total knee replacement. Hiking wasn't a problem, but when I put on a backpack with any weight, it was unbearable. I knew there was something wrong. And then I went in and made an appointment with Dr. Manthe here in Springfield, Missouri, and had never met her before, but went in and explained what was going on and what I like to do, and we connected immediately.
When I first met him is when we were working on his hip, and he had previously had a hip surgery and it wasn't doing well. It was hurting him. He wasn't able to do what he wanted to do.
I felt listened to and I felt seen, and she asked me what I wanted to do after the knee surgery, and I said I'd like to hike the Pacific Crest Trail, and she's like, right on.
For his knee, John had osteoarthritis, which is, common as we age. You lose the joint space, you lose the cartilage, it just becomes painful. So for J&J wound closure products, ones that I like the best are their Prineo, which is a dressing that we use, and also the Stratafix. Stratafix it's a barbed suture, but it's really strong. It's efficient as well. So when I'm putting that in for the wound closure, I trust it. I tell patients, especially within knees, you can move your knee and bend your knee as much as humanly possible. Prineo dressing, it's fantastic.
When I look at the scars, I'm just reminded how grateful I am. Got full function of both the hip and the knee, and maybe even better than ever. The goals that I'm chasing now, the next most immediate one is to go west and do some wilderness backpacking and get way off the grid. I also want to continue bike racing, and doing that training is just so good physically and cardiovascularly. And I really want to introduce Ashley and Charlie to some of this backcountry camping, get them up into the mountains and the places I love.